Okay, let's unpack this. What if I told you there's like a tiny superhero nutrient your body really needs, and it's super important for things like strong bones, maybe even feeling good? We're talking about vitamin D.
Yeah, exactly. Vitamin D is it's crucial. Think of it like this. It helps your body actually use building blocks like calcium.
Ah, right, for strong bones.
For strong bones, yes, but also keeps your body's defense system, your immune system, ready for action. And, it can even give your mood a bit of a boost.
Okay.
Without enough, you can run into problems. Things like weaker bones, feeling tired all the time. It's pretty fundamental.
So our mission today, then, is to take a deep dive into getting your vitamin D levels checked. We want to look at how easy it is, how helpful it can be, especially actually for those of you maybe in Kingswinford. And this great info comes from an article called Vitamin D Blood Test in Kingswinford, your guide over on the Blood Test UK website.
It's a good recourse.
So what's a vitamin D test actually like? Is it complicated?
No, not at all. Here's where it gets really interesting. Getting tested is super simple.
Okay.
It's just a small blood sample, usually just from your arm. Quick prick.
And do you need to prepare, like fasting or anything?
That's the great thing. You don't need to stop eating or drinking beforehand. So honestly, it's really easy to fit into your day.
That makes a difference.
It really does. The whole thing is quick. You can go right back to your normal activities afterward. They look for something specific. It's called 25-hydroxy vitamin D.
Right. You mentioned that. What is that exactly?
It's basically the main form of vitamin D stored and floating around in your blood. So measuring that gives the best picture of your body's overall levels.
Gotcha. Okay, so why is testing in Kingswinford specifically maybe a good example for us? What makes it good for people there?
Well, if you live in or near Kingswinford, you're actually in luck. It ties into that accessibility point.
Oh, so?
It's just super easy to find places nearby to get tested. The article mentions places like Kingswinford Medical Practice or Russell's Hall Hospital.
All right, local places.
Exactly. It makes it so much more convenient to, check on your health without a massive trip. Takes away one of those barriers.
And I saw something about speed, too. Getting results.
Yeah, that's another plus. The results often come back really fast, sometimes, like in just a few days. So you get answers quickly, you're not left wondering for ages.
That's good. What about cost? Is that easier, too?
It seems so. It tends to be more affordable, perhaps, getting these tests done locally, like in Kingswinford. And sometimes the NHS might even help cover the cost. Plus...
Oh, and home kits.
Yes. There are even kits you can get to do a test right in your own home. So loads of options, really.
Okay, so you get your results back. It's like getting a report card for vitamin D. How do you read it?
Yeah, kind of. Basically, you get a number. If your number is, say, below 25, the units are a normal L, but let's just say below 25.
Okay.
That means you likely need more vitamin D. This might be why someone feels tired or gets aches, maybe bone pain.
And if it's higher?
If it's above 50, you're doing great. That's generally seen as a good, healthy level.
So what really stands out to you there? If someone finds their levels aren't quite right, maybe they're in that lower range, what should they do? Should they panic?
No, definitely don't panic. This raises that important question. What can you do? And the answer is usually quite simple.
Like what?
Well, you can look at your diet. Eat more foods with vitamin D. Think oily fish like salmon or mackerel, or maybe fortified milk or cereals.
Okay, food first.
Food first is often a good start. Also, getting a bit of sunshine safely, just, short periods without sunscreen can help your body make its own vitamin D.
Safely being the key word there.
Absolutely. And if those things aren't enough, or if your levels are very low, your doctor might suggest taking a supplement. It's all about using that test result to make smart choices for your health.
It makes sense. But why keep checking? If you get your levels up, are you good forever?
Not necessarily. That's a really good point. Even if you feel fine, sometimes you can have low vitamin D and not even know it. It doesn't always have obvious symptoms, especially at first.
So it could be silently low.
Exactly. And that's why experts often say it's a good idea to check your levels maybe once a year or so, just to keep tabs on it.
And some people might need to check more often.
Yes, definitely. Some groups, like older adults, people with darker skin tones, because melanin can reduce vitamin D production in the skin, or women who are pregnant or breastfeeding, they might benefit from checking a bit more often. Maybe every 6 months.
Right.
It's really all about keeping your body strong and healthy, being proactive rather than waiting for a problem.
Okay, so let's sort of wrap this up. We've seen how important vitamin D is way beyond just bones.
Affects immunity, mood.
Right. And we've seen how easy and beneficial it is to get tested, especially using places like Kingswinford as an example of good local access.
Absolutely. Knowing your vitamin D status, it really empowers you and lets you take those simple steps that we talked about: food, safe sun, maybe supplements if needed.
Yeah.
It helps you keep your body at its best.
Yeah.
It's all about being, proactive with your health, taking charge.
So here's maybe a final thought for you listening. If knowing your vitamin D levels can help keep your bones strong, your immune system happy, maybe even lift your mood, what small step could you take this week just to learn a little more about your body's own superhero nutrient?